So thank you for joining the Center for Justice and Law's Spotlight Conversation series, where we talk about topics on health, justice, and law with guests. We're Emma and Sadie, and we're students in the Health, Justice, and Advocacy class this semester. We are partnering with the CJL, and today our Spotlight Conversation will focus on the topic of birth and incarceration. Our conversation today will be with Raelene Baker, who is the program director of the Minnesota Doula Project. Thank you for joining us.
Thank you for having me.
I've asked you to join us today this week because we're focusing on prison doula, birth, and incarceration, and we felt that with your background, you would be perfect. You inspire us because you are associated with the Minnesota Prison Doula Project and do incredible work to attain reproductive justice. So, can you tell us about the work you are doing for your community and how you got started in this line of work?
Sure. So I work for the Minnesota Prison Doula Project, as you shared, and I have been doing this work since it started in 2008. At that time, I was working in the community as a community birth doula in Minneapolis and working with all sorts of different clients, single moms, teen moms, low-income families, those kinds of clientele, and was able to connect up with some other doulas who were looking to do work inside the prison system in our state, and connected up with a group of doulas at that time and spent a couple years with program development, and then launched services at the correctional facility here for women in 2010, and have been working there ever since. And since then, we've expanded some services throughout the state. And our primary focus when we started was providing doula support, which is physical, emotional, informational support to people who are pregnant, giving birth, and postpartum. And we've expanded services to include other things like prenatal education, parenting education, peer support counseling, supportive visitation with parent and child. And then now we've been doing a little bit more reentry type of support, supporting people as they reintegrate back into their community. And then our nonprofit has also expanded into other areas such as Alabama. We work with, we have a sister program under our nonprofit called Alabama Prison Birth Project. That's a real quick snapshot overview.
Yeah, thank you for that.
Yes. So how does your work connect to the work that we do at the Center for Justice and Law here at Hamline?
Yeah, we have been so grateful to be connected up with Hamline for quite a number of years. Actually, one of our board members, she's the co-chair right now, Dr. Colleen Bell, first was our first introduction to Hamline University, and we would speak in her class every year until she retired. And more recently, we have been connected up with Susie Keefe in a couple different ways. I encourage everyone to check out our website, mnprisondoulaproject.org. We have a page on there for the Prison Birth Storytelling Project that turned out amazing. There is podcasts on there, a booklet. There is some videos on there, and they also put together it was a senior seminar last fall, and they put together social media posts and things like that. And so that has been a really fun project for our team to work on. And so yeah, just different ways we've been able to be connected up and kind of have that mutual partnership. It's been really, really great to meet a lot of fun students and just kind of, see what they're working on and their interests, and them being able to share some of the things like the social media and different things that we haven't really tried within our organization. So that has been a really cool partnership. So we really appreciate that.
Thank you. In your experience working, how have incarcerated women felt, and what have they gone through while being pregnant, and how have you helped them recover?
Oh, a wide variety of experiences, of course, as you can imagine. People being incarcerated, one thing to remember is that they are experiencing something that is very emotional, being separated from families, no matter, what has happened to lead them to being incarcerated. The people that we work with are parents and parents of minor children. And so we think about that, is affecting their whole family. And, you know, and then most of the clients that we work with are adding a new baby to their family. And so there's all those kind of things. Sorry, I have to keep refreshing on my phone. I don't know. This is my first my first Instagram live, so I apologize.
No, it's okay. It's okay. Thank you.
Yeah, so I don't know as far as how they felt. Some of the feedback that we've gotten is that just having that emotional type of support is really important and has become something that they really look forward to and rely on for getting through, you know, those kind of experiences, giving birth and then having to separate from your baby and just having to do that all alone without the support of family or friends, partner, loved one. So we're able to kind of step in and fill that as a professional support, but it ends up being sort of that only type of support emotionally with somebody that they know and have been able to be connected to before the baby is born. So in addition to hospital staff and correctional officers, it's just the doula. So that role has become really important. And then as far as helping them recover, I think I always kind of describe it as when we go in and we teach our prenatal classes and we are in there every week, it's us kind of helping create this community of them to support each other. So, you know, we're not there incarcerated, we're not pregnant there, and but there are other people in similar situations, and our program kind of allows that space to come together and you know, so then they can support each other and they're going through the similar experiences. And so there's a lot of peer support going on within our program when we come together in the group. So I think that, you know, the feedback that we get, that is really helpful to be able to come together with the other people that they maybe wouldn't have otherwise met. At the prison, they're all sort of spread out throughout different living units. And so our group kind of creates that connection for them, and then they can support each other throughout the week and get to know each other. And so, yeah, so I would say that's probably one of the more important things, that whole emotional creating community type of support.
Yeah, thank you so much. Just going a little bit more into depth about that, how long do the doulas typically provide service after the incarcerated people give birth?
It really varies, you know, depends on how long they're incarcerated after the birth. We always will do at least 2 postpartum visits one-on-one with our client, and often it's many more than that, depends on when their out date is. We always encourage our clients to return to the prenatal education class. They can keep taking that until their baby is a year, sometimes even longer than that, to just, again, get that group-based support and community. So we do see our clients for a long time, usually after. And then, as I mentioned earlier, just starting to work a little bit more on reentry type of support, being able to follow them back into communities. So yeah, we are able to have this sort of long-standing relationship with them that just kind of helps you know, process the different things that they're going through, and then eventually to be reintegrated with the family if they want to keep working with the doula. You know, many times they feel like it's supportive and they want to keep that relationship going. And so, yeah, so it depends on the situation, but often it is a long time after. It could be a number of months, up to a year even.
Thank you.
Yeah.
So to continue talking about your line of work, in the education classes that the Minnesota Doula Project teaches, the goal is to nurture healthy parent-child relationships and increase parenting confidence and skills. And what are some things that you can explain about the classes and what is taught to help these important skills prosper?
So we have a couple different curriculums. One is pregnancy and beyond. That's probably more relevant to the conversation we're having today. And that class is open to anyone who's pregnant and all the way up to 1 year postpartum. So, you know, in that class, we're talking about healthy pregnancy, taking care of yourself physically, emotionally, and then we're getting into childbirth topics and really talking about like comfort measures, but also advocating for yourself, what to expect during the birth, you know, different pain medication options, all of those kind of things, and as well as recovery, like taking care of yourself after birth and what to expect there. Get into a little bit on postpartum depression. We have like a self-evaluation screener and just kind of warning signs, things to be watching for. Being incarcerated and separated from your baby is another risk factor that makes you susceptible to postpartum depression. So covering those kind of topics. And then we get into child development, kind of that first year, what to expect, different milestones for baby. Talk about co-parenting and dealing with the separation in that first year, and then also ways to connect with your young baby while you're separated. Talk about breastfeeding, pumping, drying up milk, other kinds of wellness topics, emotional, physical health. So it really covers a whole wide variety, thinking from first finding out you're pregnant all the way up to your baby turning 1. And then, as I mentioned, we also have sort of that emotional community type of support. So our classes are usually about half topic and education and then half group-based support. So that kind of covers a whole lot of topics. And just to touch on it briefly, we have a general parenting class that we call Mothering Inside that covers just more general parenting topics from school success on how to support your child, with school while you're away from them, while you're separated, to nutrition and reintegrating with your family post-incarceration and addiction in the family and lots of kind of unique things that would apply to this population that we work with, and just more kind of general topics that they can use now while they're incarcerated and then once they go home too.
Thank you so much. Is there any knowledge, information, or any misconceptions that you wish the general public knew more about when it comes to prison birth and reproductive justice as a whole?
That could be a really long conversation, but I think, educating yourself, seeing what you can, there's lots of information out there. There's documentaries, there's books, there's, looking through our website and just educating yourself about some of these topics if you're interested. I did want to share this book that, I don't know if you guys have heard of it, We Are All Criminals by Emily Baxter. And it says on the front cover, it says 1 in 4 people have a criminal record, but 4 in 4 have a criminal history. So really just kind of, we could all be going to prison or being arrested, or, we're not all, we all do things and we don't all get caught, and some of our clients are there for something that we could be there for. So this is a really good book, really well done, just really gets into a lot of people's stories, and it talks about some of the racial disparities among incarceration rates and everything like that. And so yeah, there's a lot to know, a lot to learn. This has just been my life's work, and I'm going to continue doing it for a couple more decades, and there's a lot to do. And so if it's something that you're interested in, I would just encourage you to just see what you can do to learn about it and where you can kind of fit in for advocacy. I mean, there's a lot of work to do in the criminal legal system today.
Yeah, definitely. In our class, we have recently learned about the Healthy Start Act. Can you talk a little bit about how laws and policies such as this contribute to reproductive justice?
Yeah, absolutely. I think laws like the Healthy Start Act and some other things that have been popping up both state and federally are really getting at the human part of the people that are inside. They are human beings with families and children, and some of these laws are really looking at not just the person, but how can that person pay the debt to society, as well as lessen the sort of collateral damage that it has on their children and their family and the community as a whole. Whenever a parent goes to prison, it really is putting burden on those other areas in their life, who takes care of the kids, where they're going to school, like all of the things that, are still going on when the parent isn't in the picture, they still need to be addressed by someone else besides the parent when the parent is absent. And so Healthy Start Act looks at the individual and looks at what they're incarcerated for, what the length of time is, how, are they pregnant? Have they recently given birth to a baby? And how can we get them back together with their baby to reduce that separation and do so that does not compromise the safety of community. So that's what Healthy Start Act does. We have 2 clients right now out on Healthy Start Act, with at least 1 more being screened right now. And so those are children that will be able to be with their parent in a community-based alternative instead of just straight separating them. And so that the hope is then that will help them, just be reintegrated with their family and not have that separation, not have that affect the child in that way. So it's a step, it's a good step. It's a step in the right direction. Like I said, bringing kind of that humanity aspect into it and just looking at the individual instead of one size fits all, kind of why we've gotten into this situation, the war on drugs, and kind of just giving everyone these, mandatory minimums and things like that have gotten us to where we are with mass incarceration issue. And so it's just kind of taking that more individualized look is what the Healthy Start Act is doing, and hopefully it'll expand to be able to help more people with the Healthy Start Act. Yeah.
Thank you so much. So when you were talking about the classes, you mentioned teaching advocacy. So how does advocacy happen in prison for these individuals?
We talk a lot about self-advocacy, speaking up for things that you need, and that can be really hard when you're in a controlled environment like a prison. And so doulas do that too. We advocate for our clients, but really just helping them find their voice to talk about things that they need to be successful. And when you're talking about the birth, you're talking about things that they need to have a safe and healthy birth. What else? Let's see. What else? What did I miss part of that question? I'm sorry. You can repeat it if you want.
Oh, yes. So it was just about how does advocacy happen in prison for these individuals?
Yeah, so I think I answered it then. Just helping them find their voice, reminding them that they can speak up for medical care, nutrition needs that they have, medication, doctor visits, all of those things that kind of take for granted when you're not in an environment like that. So it just takes that extra step, and sometimes the doula is just kind of there to remind them that yes, you can speak up for your care, and we can never speak for our clients, but we certainly do advocacy in other ways. Like you said, the Healthy Start Act is one example that we're able to advocate for our clients on the inside and kind of elevate their voices. And all of our programming is developed and tailored, just right from the people that we serve. And it's never what we think they need. It's always them telling us what they need and then kind of co-developing it together. And that is from our programming, all the different components that we offer, to different legislative advocacy work that we end up doing and those kinds of things.
Yeah, and so the work that you do, I'm sure is very heavy. So what are some things that you do for self-care, and how do you avoid burnout?
Yeah, that can be really hard. We have a really small, close knit group of doulas that work together, and we are always supporting each other, checking in, backing each other up. When we work with our clients, we are one-to-one matchups so that client knows who to expect at their birth, and they have gotten to build that relationship with them. And so when we take on a client, we are really making a big commitment to that person. We don't take that lightly. But then, like you said, we want to avoid the burnout. And so we want to make sure that we're not taking on too much work, that we're really making sure that we're able to step away and process work, take a day off if we need to, call in backup if we need to. We really have to protect that. Protect ourselves with that self-care. It's not always easy, there's times where, may have to step away for a little bit because it's really heavy, or you just really have to do some extra processing. We always, as a team, we make ourselves available all the time. If we have to call each other in the night, we're at a birth and we just need to talk something through. I always tell my doulas, and for myself too, when leaving a separation visit, just as much as you can to just not work the rest of the day and just try to take some time to yourself and just kind of process. It's really a hard thing to witness. And then, of course, your client is always on your mind when you leave that separation visit, because you can't just pick up the phone and call them or text them, how are you doing? There's a whole process to get set up with a visit to be able to see them back at the facility. And there's a time period that we have to wait in order to see them in person. And so, they're always on our mind, and that can be really emotionally draining too. So yeah, so it's just being really intentional about that self-care and kind of, making sure that you're keeping up your professional boundaries and making sure that you're separating as much as you can. But it's hard. It's really hard. And I think really just balancing the work is key, and not taking on too much and taking a break when you need it. And we've been able to support our team in that. And, and that seems to work well for us.
Yeah, definitely. Self-care and mental care is very important, especially for this subject. It can be tough at times. How can we support or elevate the work that you do?
Like always, donations are always helpful. We have a very, patchwork kind of funding that we have. We have grants and contracts, but we do rely a lot on individual donors, monetary donations, but also like we are often helping our clients get on their feet when they get out of the facility. And so we are, baby clothes for themselves, hygiene products, all those kinds of things. We try, we collect donations for different things. We have Amazon wish lists on our website. Things like that are always really, really helpful. If you're on our social medias, sharing different posts and just getting some information out there is always great. If you see something on our social media or website that we have an event coming up, and just sharing with other people is really, really helpful, just to try to get the word out there of the work that we do. And also other, prison doula programs or other groups that are doing work with incarcerated families, just really trying to elevate them. And there's a lot of different ones out there, and just to know that they exist. And many of us are out there doing work as a nonprofit and rely on donations of either monetary donations or different goods, diapers, wipes, products, things like that. And so, if you're not local to the Twin Cities where we're located, seeing what else is out there in your community and how you can support this population in different ways. And that could even be directly through a facility too. I mean, there are different outreach programs that are always looking for either volunteers or donations of different things. And so I would just be aware of what's in your community and how you might be able to get connected.
Thank you so much for that. And our last question is, do you have a call to action for our audience?
I actually did think of one that was specific to a need that we have right now. We are helping, in partnership with our prison, we're helping some moms get their breast milk, their pumped breast milk, to their babies. And so we are actually in the need of, like if you have like a meal kit delivery service where you get like these insulated boxes with frozen foods, like Daily Harvest, HelloFresh, Blue Apron, there's tons of different ones, right? We're looking to collect donations of those kind of cooler boxes to be able to ship breast milk in. So it's a good way to recycle those boxes that you may otherwise throw away, and we could reuse it and be able to get the milk shipped to babies. So if that is something, someone out there has some of those boxes and they want to donate, connect up with us and we can arrange a pickup or drop off. And then we also buy a lot of dry ice to ship the breast milk too. So we usually get it at Hy-Vee. So gift cards to Hy-Vee to help us buy dry ice to ship breast milk to babies would be really helpful. So that's my one specific call to action, of course, in addition to the other things I said about donating and things like that. But yeah, that would be awesome. If anyone knows anyone who uses a meal kit, delivery service, let us know if we can have your boxes.
Yes, thank you so much for just having this conversation with us today. I know these conversations are so important and essential to have if we want to create change, and we've just learned so much from you in just this small amount of time. So just thank you so much again. And with
Absolutely.
that, for the viewers, please be sure to follow us on Instagram and Facebook and take a look at our class's previous Spotlight conversations. Thanks for tuning in, and thank you so much again, Raelene.
Thank
Thank
you.
you. Have a good day.
You as well.